When you first find out you have breast cancer, it's normal to feel frightened, overwhelmed, uncertain. During this challenging time, it is important to gather as much information as possible to determine the right treatment options for your disease. This video is about the Oncotype DX test, a test that will help you and your doctor determine whether chemotherapy should be a part of your treatment plan. The good news: breast cancer is a treatable disease. It is a disease that most patients can survive thanks to the great strides in treatment that doctors and researchers have made over the past 30 years. In addition, advances in the field of genomics have made it possible to characterize the unique biology of each patient's breast cancer and predict the likelihood that the disease will recur for that person. This knowledge helps physicians and patients tailor a specific treatment plan that avoids overtreating or undertreating with chemotherapy. Laurie, a writer and anthropologist, was no stranger to cancer. At age 28, she had been diagnosed with stage 3B non-Hodgkin's lymphoma. As part of her treatment for lymphoma, Laurie received maximum doses of doxorubicin, a commonly used chemotherapy agent. Laurie enjoyed excellent health for the next 30 years until an abnormality was detected during an annual mammogram. A biopsy confirmed that Laurie had breast cancer. After having surgery, Laurie and her oncologist had to decide whether or not to include chemotherapy once again as part of her treatment plan.
Because I had received a protocol that included adriamycin, I was at increased risk for cardiac toxicity, leukemia, were I to have to receive chemotherapy again. So the issue of receiving chemotherapy, whether I would benefit from chemotherapy, became a very, very big consideration in my case.
After surgery to remove their tumor, many women receive additional therapy, also called adjuvant therapy, to treat and help prevent the cancer from returning. That treatment may include radiation therapy, chemotherapy, targeted biologic therapy, and/or hormonal therapy. Hormonal therapy is often used to lower the risk of a hormone receptor-positive breast cancer from returning. Hormonal therapy typically blocks hormone receptor sites on cancer cells that multiply when stimulated by female hormones such as estrogen and progesterone. Likewise, other types of hormone therapy can be used to block the body's ability to produce female hormones. Chemotherapy uses drugs to kill cancer cells that remain in your body after surgery. A number of chemotherapy regimens are available for treating breast cancer, and while chemotherapy can be an important part of a breast cancer treatment plan, studies show that in early-stage estrogen receptor-positive breast cancer, only 4 out of 100 women have a large benefit from it. This means that if all these women received chemotherapy, 96 women out of 100 would not benefit significantly, if at all. Laurie's oncologist suggested that she take the Oncotype DX test to aid them in making the decision about chemotherapy. Oncotype DX is a genomic test that helps identify which women with hormone receptor-positive breast cancer are more likely to benefit from adding chemotherapy to their hormonal therapy treatment. The test also measures the likelihood that a woman's breast cancer will return or spread within 10 years, assuming she undergoes 5 years of hormonal therapy. This information, along with traditional measures such as your age, tumor size, hormone receptor status, and tumor grade, may be useful in helping you and your doctor determine a treatment plan that's right for you. The Oncotype DX test examines the activity of 21 genes within a tumor sample. The results of the test are reported as a recurrence score result, which is a number between 0 and 100. A lower recurrence score, in this case 5, means that there is a 5% chance that your cancer will return or spread within 10 years of your diagnosis. A lower recurrence score also means you have a cancer that is less likely to respond to chemotherapy, so you and your doctor may decide that the benefits of chemotherapy may not outweigh its risks. A higher recurrence score, in this case 44, means that there is a 30% chance that your breast cancer will return or spread within 10 years of your diagnosis. A higher recurrence score also means you have a cancer that is more likely to respond to chemotherapy. So you and your doctor may decide that the potential benefit of having chemotherapy now may outweigh its risks. In addition to the recurrence score, the Oncotype DX test provides specific measurable scores for certain individual genes, such as estrogen receptor, ER, progesterone receptor, PR, and human epidermal growth factor receptor 2, HER2. Knowing these individual scores, together with a recurrence score, can help your doctor recommend a treatment plan based on the specific characteristics of your tumor. When Laurie received her Oncotype DX test results, she was relieved to find out her recurrence score was 17. This score meant she had a relatively lower risk of her cancer coming back. Laurie completed radiation therapy and is currently taking hormonal therapy.